Did you know that Amazon have just entered India's $15 billion medical industry by offering at-home testing? Why do I think that's important? If you follow me for some time, you will know that I am passionate about everything to do with women's health and health apps. And one of the things that I think is very interesting when you look at the App Store or the Google Store for reviews about different apps is where those apps have actually been used. So you can actually find information of the top 3 countries where those apps are used. And what's often surprising to me is that the apps will boast we have, over 20 million downloads and 1.1 million 5-star reviews. And then you will find that those apps have actually been used in countries that are resource poor. And that often pushes up the ratings, because if you didn't have access to healthcare and then you could download an app that was genuinely helping you, of course you would think it was 5-star. But if you are in a country where you have good or better access to healthcare and you have an app and you realize that that app is, manipulating your medical data and trying to sell you marketing and other things, then you may not rate that app as 5 stars. And so it's very interesting to me that Amazon have decided to trial home diagnostics in India. Why not any of their other countries? I think this could be a testing phase. think this could be a testing phase to get all of those reviews. I think it's a very good marketing play. On top of that, they're not just doing diagnostics, they have a full run-through system from home diagnostics right through to medical consultations. So they're essentially trying to take over the medical industry in India. As a doctor in the UK at the moment, where we still very loosely have a national health service, I think this is really worrying. It worries me how people may be manipulated to pay for various aspects of their healthcare. The lack of ethical and moral decision making around taking people's money and exploiting them also worries me. And I think that as we move forward, we're going to be really asked to question which camp we fall into. Do we follow big tech and big pharma, which for all intents and purposes I think are pretty much together? Or do we go back to, which a lot of people are doing, getting back into nature, getting back into eating really well, getting outside in the sunshine, looking after your body? I think the future is a preventative space, and if I was going to give you any advice, that's where I would go. I think it's going to be testing times ahead. Hope this helps.